This is the os coxa. This is the medial side. This is the lateral side. And this bone makes up the half of your pelvis. It's going to articulate here with the sacrum. Here there's a little pad of cartilage to make the pubic symphysis, and together all of those pieces make your pelvis or your hips. This is what we think of as the hip bone when we think of that. So the os coxa, when we look from the anterior side, we've got this surface right here, which if you squint, vaguely ear-shaped, sort of, this is called the auricular surface, and it articulates with the auricular surface of the sacrum, both of those ear-shaped surfaces. Just remember that it is auricular and not articular, even though it does articulate there. This big surface here is the iliac fossa. This bone, this os coxa, actually began as 3 separate bones in fetal development. This one is the ilium, this one is the pubis, and this one is the ischium. And so the markings are going to have those names on them. So this indentation here, this is our iliac fossa. This is the pubis. You can see that's pretty pointy there, that little corner there, much pointier than this here. And that's going to help you orient yourself which of those is the pubis and which is the ischium, because the ischium, this big round bump on the ischium, is the ischial tuberosity that you sit on. This, on the other hand, is going to go in the front of your body. There's a pubic symphysis that's going to sit right here. We call this the symphysial surface. So it kind of sits like that, so you sit on that part. And that makes sense. You don't want to sit on that pointy thing. So this is the ischial tuberosity. And then this big hole here is called the obturator foramen. We often just call it the obturator. Now when we turn this over, now we see the lateral side, and now we see this really obvious cupped shape indentation. And that's called the acetabulum or acetabulum. And here we've drawn in the lines between the 3 bones that make up this os coxa. So this part is the ischium, this part is the pubis, and this part is the ilium. So the acetabulum has portions of all 3 of those. Now, just behind the acetabulum, this is the posterior side, we have this really distinct notch, and this is called the greater sciatic notch. Okay? This is narrow on male pelvises and wide on female pelvises. So this is definitely male. On a female pelvis, we'll often see it like that, very, very wide. We also notice that the top of the ilium here has a crest, and you can see it kind of actually dips over on that posterior side. So this is called the iliac crest. And there are important markings here and here at the ends of that iliac crest. Now remember, this sciatic notch, this is the posterior side. So this is the posterior end of the iliac crest, and this is the anterior end of the iliac crest. All right, now these 4 markings, this here, 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 these are called iliac spines. So this one is the anterior superior iliac spine. This is the anterior inferior iliac spine. This is the posterior superior iliac spine. And you guessed it, posterior inferior iliac spine. So just remember the PIIS, posterior inferior iliac spine, is just above the greater sciatic notch. All right? So iliac crest, iliac spines, posterior superior, posterior inferior, anterior superior, anterior inferior, acetabulum, obturator foramen, ischial tuberosity, symphysial surface, iliac fossa, auricular surface, ilium, pubis, ischium. That's your os coxa.